Welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, February the 17th. We are joined today by our CEO, Nicole Dupuis, and our Acting Medical Officer of Health, Dr. Shankar Nesathurai. We will start today with opening comments from Nicole and then opening comments from Dr. Nesathurai, and we will move into the media questions after that. Thank you very much. Go ahead, Nicole.
Good morning, everyone. Thank you for joining us. Happy to start off today to acknowledge that today is Random Act of Kindness Day. We have talked a number of times about, language and, treating each other throughout this pandemic with kindness. It is a stressful time and has been a stressful time for everyone. And so just want to, remind everyone that today is a day to speak and act with kindness. And there's the saying that it's the small things that count. And, a small note, small message, and a small act of kindness, if we can all remember that today, I think, at least for today, we can make today a better day. So just wanted to start off with acknowledging Random Act of Kindness and really just thanking our entire community for everything, that they've done throughout the pandemic. It has and it does take a village, and so that'll be, our words for today is just a thanks to everybody.
So, colleagues in the media, thank you so much, and I echo Nicole's perspective. Dialogue, kindness, compassion, they're all important constructs, and I think all of us should work towards affirming those ideas. This past week has been replete with announcements by provincial authorities. There are additional relaxations that are being promulgated today and on March 1st. The Public Health Service makes decisions for Windsor-Essex based on provincial guidance, provincial direction, as well as the local epidemiology and realities, the unique nature of the Windsor-Essex Health District. We're going to be continuing to monitor indicators of disease burden in the community and continue to formulate our public health plan based on the data that is available to us as we move forward. My colleague Ramsey had prepared an epidemiological summary, and I think a general point that I would make is that the indicators suggest that there's a diminished burden of disease in Windsor-Essex. But as always, we should be cautious in interpreting the data. If there's one thing that we know from the pandemic over these past 2 years, and we'll be starting the third year of the pandemic next month, is that it's unpredictable. And disease burden, at least in the past, has waxed and waned, and public health measures have also been modulated by the level of disease burden. So my one core message is, as we move forward in these next few weeks, is to continue to monitor the data and also to be cautious, and we will remain cautious as we move forward. Thank you. I'm happy to take any questions, and the rest of the team is as well.
Thank you very much. Just to note for our media outlets, our manager of epidemiology is on the call here, should there be any questions for that topic. So we'll move into our first round of questions, limiting it to 2 per outlet, starting with questions from CTV.
Good morning. Given those comments, do you think the region is ready for more reopening then?
Well, I think the province has made a decision for the province overall related to the level of public health measures and restrictions. And I think that we have to continue to monitor what the effect of these relaxations would be to the important metrics of disease burden. At this point, the measures of disease burden that we have are death, the number of people being admitted to the hospital, the number of people in the ICU, and wastewater data. One thing to think of contextually, and Ramsey will correct me, but the numbers that we have are that we have approximately 430,000 people in the district, and about 50% have their third dose of vaccine, so they're up to date. And we have about 70,000 people who do not have any vaccine at all, of which approximately 20,000 are children and 50,000 are adults who are potentially eligible for the vaccine. And I think the remaining 150,000 or so are people who've had 2 doses of vaccine. One thing to consider is that most of the people who received 2 doses of vaccine got their second dose in the summer of 2021, probably in August, September, July, those months. And vaccine benefit or vaccine, the vaccine starts to wear 3, 4, 5 months after the injection. So as we move forward, we have maybe half the people in the district who have 3 doses, but we have a group of people who have 2 doses but have increasing susceptibility as time goes on. And we would encourage those people to get their booster dose so they can be up to date and have the best possible protection. So sorry for that long-winded answer, but thank you for asking it.
Thank you. And like usual, will the health unit be working to educate businesses and residents, kind of, I guess, how usually it is when we move to a different stage of loosened restrictions?
Yeah, so similar to any changes, takes our team a minute to review those changes and make sure we're on top of them, and we'll always start with modifying information on our website if it's significant changes. We send out memos through certain sectors and businesses, and definitely our team is always out in the community. And as we've said many times, education is always, our priority first. And so, so we will continue to make sure that everyone is aware of what are the changes and how do they affect them specifically at the business.
Okay, thank you.
And if I could just give you the numbers, I'm just looking at my notes, and the best estimates with 183,000 people who have 3 doses of vaccine and therefore are up to date. We have 155,000 people with 2 doses of vaccine, and in that community of people, many of them are 3, 4, 5 months out from their second dose, and we have 78,000 people who do not have any vaccine at the current time. The other modulating factor is that some of the people in the community have natural, or they have immunity that's related to being infected with COVID in the past. Theoretically, or at least conceptually, that does provide benefit, but the benefit is probably not as good as the benefit from being vaccinated.
Thank you.
Any questions from CBC?
Yes, good morning. Windsor Regional Hospital announced that they're, slowly starting to plan to return non-elective surgeries after being on hiatus. And there's quite a big backlog. I think they have more than 4,000 people waiting for a surgical date now. I'm just wondering, from a public health perspective, how important is it that we're returning to these surgeries? Hopeful they'll be able to continue.
Well, I have to say that's a wonderful question because, so maybe I could comment on it. 4,000, the last time I inquired about this, there are about 4,000 people waiting for surgeries at the hospital. If there are 430,000 people in the health district, that's about 1 in every 100 people. 1 in every 100 people is waiting for a surgical procedure. And so one of the consequences of the pandemic is that other health services are communities being deprived of other health services because of the burden of COVID disease. Now, that's not exclusively because of COVID, but it's substantively because of COVID. Secondly, There are people who are waiting, who have clinical symptoms, who are waiting for investigations. And because of COVID-related restrictions or COVID-related disease burden, those people are waiting for investigations. So it's just not people waiting for surgery, but it's all people waiting for their tests to be done so we can find out what is wrong with them. And then some of those people will need surgical treatment. So I think it's a really significant issue that we have people who are waiting for care or care that's delayed. And that is one of the reasons we follow the metric of the number of people currently in the hospital with COVID or the number of people currently in the ICU with COVID. It is a positive signal that the hospital feels comfortable and capable of restarting scheduled surgeries. And we'll continue to monitor that as we continue through the pandemic.
Thank you. And just to follow up about what you were saying about vaccine efficacy and the fact that, you know, as you get further away from the time you got a jab, the vaccine offers, you know, maybe isn't as effective as it was when you first got it. It's something that medical officer of health in Chatham-Kent also spoke about this week. Are your colleagues, the other medical officers of health across the province, you know, kind of pushing now? Maybe it's time that 3 doses is considered fully vaccinated?
Yeah, I just, you know, I can comment on the Windsor-Essex Public Health Service. The best possible advice that we can give people is to be up to date on their vaccine. And being up to date is getting 3, at the current time, is getting 3 injections, which means to get the booster. From my perspective, we should use the term up to date, just like we use for other vaccines. And if you have 2 vaccines, you are not up to date, from my perspective, meaning that you're not fully protected. And the whole idea of being vaccinated is to protect yourself and to protect your family and to protect the community.
Okay, thank you.
Any questions from Blackburn?
I note that today we're going to start vaccination's 3rd dose for 12 to 17. Could you speak a little bit about how prepared we are for that?
Well, maybe Nicole can talk about the operational issues, but we are prepared.
Yeah, I think he said it. I know we've said this all along. We have had a really robust strategy and system in place for vaccination here. We are definitely prepared for the rollout of the 12 to 17 boosters. You know, we still have our Sears site, which is open and available as well. We have the Grovedale site in Kingsville, the mass vaccination site there. You know, as well, Hotel du Grace, there's still the site in the West End. So certainly we would encourage people to get in and book right away. There is a wind down of some of those larger facilities. So they are a great opportunity. So we would encourage everyone to get in. As well, you know, again, we've said this before, our pharmacies are participating. I think we have in total about 89 pharmacies across Windsor-Essex that are participating in vaccination, as well as primary care. And also, we do have our mobile strategy, which we've really enhanced actually over the past month. And we are working, you know, with our school board colleagues and community colleagues to bring vaccination clinics to neighborhoods, school communities, et cetera. So there'll be a lot of opportunities and certainly, you know, in whichever modality people choose, you know, that opportunity will be there. We know with children and youth as well, sometimes transportation can be a factor. So we are making sure that to remind our community and certainly our youth that there is assistance with transportation is still available. And so that's something that we'll be promoting as well.
That's the bus, right?
Actually, taxi and bus.
Okay. Now, you mentioned the mobile uptake, and I know there's been a number of pop-up clinics in schools. What's the attendance been like at those school clinics?
It's a good question. Some are better than others, but overall, we have had some good, great success with some of our school clinics. So they are generally after hours. So hopefully they're convenient for students and their parents and families. We could probably give you better sense of how they're going. But just with any mobile strategy, sometimes we have lower numbers, but the school clinics overall have been pretty successful. I think our director of that oversees our vaccination effort has said in some cases and in some days our mobile clinics are actually seeing more numbers and vaccinating more individuals than some of our larger sites. So that has been a successful strategy.
Thank you.
Any questions from the Windsor Star?
Yes, good morning. I'm wondering if you've heard any or been part of any dialogue about reopening eligibility for PCR tests back to the general public as we see fewer high-risk cases in the community as the burden decreases. Just wondering if that's something that is on the table so that we can get a better sense of exactly what the burden of disease is from that PCR testing data again.
Yeah, I can share with you that it's been my perspective that we should have enhanced availability of testing. Enhanced availability of testing helps patients at an individual level, and I think that might be particularly important as we move to having more enhanced therapeutic options, new drugs to treat. Also, I think enhanced testing will ultimately also improve our understanding of the burden of disease. At the current time, the challenge is that there's not sufficient resources at a provincial level to test everyone with the PCR test who might want one or benefit from one. But I do think that's an important goal to have adequate testing or sufficient testing. If I could just add to that comment, COVID-19 is not likely to be eradicated in the near future. So we have to shift towards the management of COVID-19 in the community. And the management of COVID-19 from a public health perspective is not that we can go back to the way things were before COVID-19. And the reason I say that is one of the things that has to happen as we move forward with COVID-19 is to have enhanced testing capacity. It means that we also need to have people still maintaining physical distancing. It means that people should stay home when they're sick. It continues to mean that there may be times when we'll have to have more public health measures and less public health measures based on the burden of disease. And it means that we probably have to think of a strategy to increase hospital and healthcare capacity for the additional burden of disease for COVID-19 as we move forward. It'll probably mean we'll have to pay as a society. We have to find and distribute drugs that are effective as they become available. And I think all of those measures are part of normalization, and having additional testing capacity is one more incremental step towards a normalization. If I could share with you, when I first graduated medical school, HIV was a new disease or relatively new disease. And at that time, we had to move forward with a whole suite of measures to bring HIV under a more manageable condition. And that included testing. That included robust HIV testing. It included providing additional hospital resources. It also had a behavior change where casual sexual encounters were profoundly discouraged. So I think that as we move forward in managing COVID-19 as a society, we need to consider all of those suite of measures. But that dialogue has to be not just among public health officials and physicians and hospital executives. It has to be among the broader community if we're actually going to get a better control of COVID-19.
Thank you.
Any questions from AM 800?
Doctor, just going back to what you mentioned earlier in regards to the number of individuals that are still eligible to receive a vaccine, there's, like you mentioned, 78,000, that's kids and adults, that are still eligible. I guess with those 78,000, the vaccine rollout for the general public, it's been almost a year now. Do you think those 78,000, they basically said, no, we're not getting it, even though health unit and other officials continue to ask them to receive it?
Yeah, I think of the 78,000, 18,000 are children under 5. They're currently not eligible for vaccine, but there are about 50,000 people who are eligible for vaccine who have not received the vaccine. I think a fair characterization is we're not only are we asking and recommending, but as a doctor, I'm pleading with those people. Most of the deaths, or the disproportionate number of deaths, are people who are unvaccinated. Many of those deaths are senseless. They're deaths of people that, if it weren't for their infection with COVID, that they would live many years and participate in their family life and be parents and children. So I do recognize that many of those 50,000 people have heard the message and heard the recommendations and elected to decline the recommendation or decline to get vaccinated. But we always remain hopeful and we're always optimistic. And I hope that those individuals who have yet not got vaccinated to get vaccinated to help themselves, but also to help their family and their children.
Just looking at this week's summary, and I know I asked this question a couple of weeks ago in regards to the number of doses being administered weekly. Once again, it's dropped again from week to week. But then looking at the chart there where it says the overall fully vaccinated for Windsor-Essex for the eligible age groups, we're at 78.4%. I guess that number, did you think we would be higher? I'm not sure if this is for Nicole or Doctor, but did you think we would be higher at this point since the vaccine rollout?
Go
ahead, Nicole.
I mean, I could start. So the overall fully vaccinated, as you know, we're just starting that point where 5 to 11s can receive their second dose. So the recommended interval was 8 weeks between their first dose, which started in November. And so, you know, I think the epidemiologist probably has a better idea of what we might have projected, but, you know, I think we've always hoped to be higher, but I think we're doing, based on our experience and our history and the different phases we've gone through the vaccine, I don't think that we expected we wouldn't be where we are right
now. If I could share, I'm always reluctant to predict the future, but just looking at the data, school children, I think in this district have 92% vaccine for the suite of vaccines, just not one vaccine, but the suite of vaccines covered by the Immunization for School Pupils Act. So to me, the goal would be to be at 92% or higher. And the current level of vaccination, except for the very old, our very senior population, is got a long way to go. I think we have a long way to go to get to the best level of community protection. It's particularly important as we move towards a period of greater relaxations from public health measures to get that vaccination rate to a rate that's higher than the current rate.
Thank you.
You're welcome.
Yep. We have time for one follow-up question from our outlets, starting with CTV.
Yeah, I'm just wondering if Ramsey's on the call, if he'd be able to talk about the takeaways from the Epi summary this week.
Definitely. So there are some key takeaways. As Dr. Nestori mentioned, we are seeing a diminished burden of illness. At the same time, our outbreaks are slowing down. We've stabilized to the point where we're seeing the same number of new outbreaks being declared from last week to the most current week. We've also seen a slowdown in the number of deaths that we are also reporting, which is a positive for us as well. Just looking at our most recent hospitalizations from last week to this week, we've seen about a 30% decline in our hospitalizations, which is also another positive indicator. Wastewater as well has shown a decline, though it has fluctuated as the week has progressed, but towards the end of the week, it has gone down. So there are positive signs there, but once again, just recognizing that just looking at our percent positivity for testing, it is at 16.4%, which is still relatively high for where we were during any stage of the pandemic. So we're cautious, and we'll continue to monitor to see how we progress as the reopening continues.
Thank you.
If I could just supplement Ramsey's comments, and he'll correct me if my interpretation is not correct, but death, hospitalization, and ICU admission, those three metrics are lagging indicators, meaning they reflect public health policy direction, vaccination status from at least 2 weeks previously. So when we look at those metrics, that's a way to judge the effect of the suite of public health measures and community action a few weeks ago. Wastewater data is thought to be more of an immediate indicator. And so given the fact that the data elements are complicated, that's why one of the reasons we are cautious about making too sweeping inferences based on the data elements that are presented to us. Ramsey, is that a fair characterization?
That's right.
Thank you.
Thank you. A follow-up question from CBC.
I'm good, thank you.
Thank you. A follow-up question from Blackburn.
Asked and answered. Thank you.
A follow-up question from Windsor Star.
No, thank you.
And AM 800.
Just one for Ramsey, just looking at the chart, making sure I have it right. So Ramsey, the 5+, where it says 82.1%, that's 5+ or 5 to the 12 range that have received 2 doses. Is that correct?
The 5+ looks at individuals 5 to our senior population. So right now that's at 82%.
Okay, but then the next category, it says 87.4%, 12+. That's where I'm just getting a little confused there.
Yeah, so I can explain that. So 5+ currently reflects everyone who is eligible to receive the vaccine. 12+ refers to those individuals 12 and above who have received the vaccine. The overall figure, the orange bar, is all of our residents, those who are eligible, so 5 and above, and those who are not, so those 0 to 4. What we're seeing right now, and if you look on our dashboard too, is that our 5+ for first doses is about 42%, give or take, and right now our second dose is at 21%. So we're hoping that those people will become eligible as time moves on, which will see our overall population possibly be over 80%.
Thank you very much.
No problem.
All right, thank you very much for joining us today, everybody. Just as a reminder, our offices are closed on Monday, so there will not be a media session. So our next meeting is planned for Thursday, February the 24th. Have a wonderful day. Thank you for joining.
You too.
Bye-bye. All the best.
Thank you.